Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report. The total number of cases remains at 300. As of this morning, there are no cases in hospital or in ICU. This morning, 284 individuals are listed as recovered, and we have 9 active cases. From June 5th to June 8th, there was 2,217 lab tests performed, taking our total to 49,591. So we continue to remind Manitobans that our numbers have remained favorable, and we've been able to gradually and cautiously reopen our economy. It is certainly not a return to normal, but we do Manitobans have learned to live with this virus, to take precautions, and each Manitoban needs to decide on their own their level of risk that they're willing to accept. We know the typical precautions: to wash your hands frequently, to physically distance when at all possible, are vital to protecting the health of ourselves and others. And then just as vital, especially as we move to our new normal, is to stay home if you're ill. We've all battled through those colds before. This is not what's going to be acceptable in our new normal. So people who are showing even mild symptoms of respiratory illness need to stay home, certainly present for testing, but we can't have people showing up to work or to school or out in public while they're showing symptoms of respiratory illness. So physical distancing when we're outside, especially when we're not with people of our same household, is vital. Good hand hygiene, and then again, in those areas where we're unable to physically distance, then wearing that non-medical mask is an option. Again, knowing the limits of that, it likely doesn't protect much the person wearing them. It provides some protection to the people around that person, but needs to be used effectively, ensuring not to self-contaminate by touching your hands or to your face or eyes. And continue to wash your hands frequently. The mask use is certainly not a replacement for the most important things: that physical distancing, staying home when you're ill, and hand hygiene. Those that are at significantly increased risk of severe outcomes, those over age 65, those with underlying medical conditions, those with immune compromise, need to be extra cautious. You need to ensure you're avoiding crowded, certainly indoor places, hand hygiene. So you need to take extra caution during this time, because we're still going to need to be dealing with this virus in one form or another for the foreseeable future. June 8th to 14th is National Blood Donor Week, and this is taking place at this time, but this is certainly not our typical time. The arrival of COVID-19 in Manitoba introduced a wave of uncertainty and concern, and has affected much of our life in Manitoba and in Canada. Canadian Blood Services recorded a significant drop in donations, and many mobile events were suddenly cancelled due to COVID-19. So Canadian Blood Services responded quite quickly by strengthening things such as routine cleaning, infection prevention and control measures, and enhance the safety, health and safety measures in the donor centers. So patients that undergo surgery, cancer treatment, trauma victims, they still rely on blood, and that need does not go away during a pandemic. So the blood supply is just as important now, and even more important because of all the decrease in donations during this time. So if you're in good general health, please book and honor your appointment to help these patients. Download the Give Blood app, or call 1-888-2DONATE, or book now at blood.ca. In addition to that, Canadian Blood Services is taking part in a clinical trial to test if plasma from someone who had recovered from COVID-19 could be safe and effective treatment for patients with the virus. To learn more about that trial and to register as a potential donor, please visit blood.ca/convalescent plasma. We always remind Manitobans to keep up to date with the COVID-19 at our website, manitoba.ca/COVID-19. And again, a big thank you to Manitobans for stepping up and putting us in this position to continue our efforts at reopening our economy. And so thank you. I'm going to pass it over to Lanette.
Thank you very much. My name is Lanette Siragusa, Chief Nursing Officer from Shared Health, and I'd like to start today by providing you with an update on the COVID-19 testing for healthcare workers. Last week, there were 361 healthcare workers and first responders who were tested for the virus in the past week. None came back positive, so it has been about a month since we've had a positive healthcare worker, which is really great news. The 26 previous positive tests have now recovered and they're all back at work. HealthLinks received approximately 5,000 calls in the past week, and as a reminder, Manitobans no longer need to call HealthLinks or see a physician to receive a referral for testing. And I can confirm that any signage to the contrary has now been removed, so people can self-refer if they're showing symptoms and have used the online screening tool, which can be found at manitoba.ca/COVID-19. That screening tool has received approximately 660,000 web visits since its launch, including nearly 30,000 hits in this past week. Again, if the screening tool shows you meet the criteria for testing, we strongly recommend you head to a community site and get tested. Finally, more than 2,100 Manitobans have viewed their test results on the online portal in the past week, and nearly 900 have received their results by calling into the COVID-19 contact center. With regards to testing sites, we have some scheduled changes involving the testing sites in Winnipeg that we'd like to announce. Tomorrow will be the final day of operations for the Sergeant Tommy Prince and Bison Drive sites. So starting on Wednesday, anyone in the city who is experiencing symptoms and needs a test, they are encouraged to visit one of the city's other 3 testing locations. So those are the MPI Drive-In Center on Main Street, the St. James Assiniboia Centennial Pool, and the Thunderbird House. Also, starting on Wednesday, besides testing, there is an assessment clinic that was located at Sergeant Tommy Prince Place. So we will now be concentrating those services at the St. James Pool location. The Main Street and St. James sites will be open 7 days a week, while the Thunderbird House will remain open Monday through Saturday. So these operational decisions have been made with the confidence that these 3 sites can meet the current demand for testing in Winnipeg. However, we will continue to evaluate and look at other options as we go forward into the fall. And for a full listing of site locations in the province and hours of operation, you can go online to manitoba.ca/COVID-19. And with that, we can open the line to questions.
Thank you. Normally at this time, I would invite media to ask their questions, but due to some technical difficulties, you'll have to put up with me. From Marnie at Global, with the protest on Friday, if people who attended are concerned about COVID-19, what specific symptoms should they be watching for, and when could they expect them to show up? A few days after the rally occurred or next week?
Yeah, so the symptoms of COVID-19, fever, sore throat, runny nose, cough, shortness of breath, weakness, headache, all of these are the typical symptoms, so I'd continue to watch for those. If you developed any of those, you should self-isolate, present for testing. The incubation period for COVID-19 is up to 14 days. And so most people would develop symptoms within 7 to 10 days after being exposed, but that could be up to 14 days. So that's how long we should really self-monitor for those symptoms. And with or without attendance at that gathering, we should all be monitoring for symptoms and presenting for testing should they advise.
And as her follow-up question, Marnie asks, different retail stores have different protocols over change rooms. Some don't allow you to try on clothing, others allow you to try it on, but then it goes to a quarantine rack. There is an inconsistency between stores. What are the rules or regulations regarding change rooms in retail stores?
Yeah, so there isn't anything specific. There's a myriad of industries and sectors that we provide overall guidance and certain public health orders for them. Other areas are going to need to, consider what works best for them in a safe way to prevent the transmission of COVID-19. Certainly, COVID-19 can live on services, but things with, clothing and stuff, if you're screening for clients, lots of hand hygiene, and this is presenting a relatively low risk situation. So it'll be up to those merchants to find what's a safe way and what is something that they can implement within their stores.
From Bud of the Brandon Sun, a question for Lanette. What accommodations are made for first responders and healthcare workers who must wear N95 masks but also wear beards for cultural or religious reasons?
Yeah, that's a great question. So we have this situation come up in the past as well. So we've always stated and truly believe that our healthcare providers, their safety is our most important priority. So when issues come up like this, if it's for religious reasons, we will work with the individuals to see if we can find a solution, but still we need to make sure they're protected as well as the patients that they serve are protected. So those conversations are ongoing, and we also know if there are any challenges with specific individuals, we'll try and work around schedules and make sure that there's no service interruptions, and we can accommodate the request.
Scott from the Winnipeg Sun asks, firstly, why were tests over the weekend not reported?
I think that's just our new manner of reporting. We're going down to the two press conferences a week. We're just rolling up the test numbers over the weekend, so that's what we reported today.
And his follow-up question, seeing rebounds of cases in the United States, when it comes to reopening Florida, Arizona, and California, what's different here in Manitoba, and why haven't we seen this sort of thing happening here?
Well, certainly Manitoba has been fortunate with our location and with the timing that our numbers when we began our reopening were much lower than many other jurisdictions that had to reopen. And so we all know that the tight restrictions can't be in place forever. The tight restrictions have effects on health as well. So there's always that balance. So a number of jurisdictions are in a very difficult position to decide on where that balance is. In Manitoba, our numbers were quite low. Our test positivity rates were well below 1% when we began to reopen. And so because we're not seeing a lot of this virus recirculating right now, that's given us that opportunity to gradually reopen without seeing that increase in numbers, although we have to be cautious because we're still at risk for the importation of the virus, and we need to follow those numbers quite closely.
From Gavin of CBC Radio Canada, for Dr. Roussin, could you give us an update on asymptomatic testing in the province? Approximately how many tests a day are being done?
Yeah, I don't really have those updated numbers. It's not really something that we're planning on reporting all that frequently. That what's really important is the ability to test symptomatic individuals. The asymptomatic, we've opened it up, done some targeted approaches to it. But the number of asymptomatic, really isn't that important of a metric. We're going to follow our test positivity rates. We're going to follow a number of those other factors, the number of cases that can't be linked to travel or to known cases. So those are the type of things we're following. So sorry, I don't have any specific numbers on that here today.
As a follow, could you provide an update on the uptake on asymptomatic testing among truckers? What proportion of returning truckers are opting for a test?
Yeah, so that's relatively new. I don't have any numbers on that back. We're going to try to see if we can get some numbers. It's going to require that it be written on the requisition as well, because this is going through the same process as at the testing sites. So our numbers reporting on that will probably be an underrepresentation, because people can just present to be tested. If they don't mention that they're truck drivers, or it's not written on the requisition, we would have no way to follow that. So again, what we're really interested in is getting the message out to certain groups that the risk of importation is high, that the asymptomatic testing is available, and it has many limitations. And so it's really important is to monitor for those symptoms, to self-isolate should they arise, and then present for testing if you had symptoms. In addition to that, there's that added opportunity to get some asymptomatic testing as well.
From CBC Manitoba, Bart asks, how are you coordinating with your counterparts in North Dakota and Minnesota on a plan for when the U.S.-Canada border reopens?
So we don't have any specific coordination right now between our U.S. counterparts at the provincial level. Certainly, there's a lot of work at the national level on the Quarantine Act and the travel restrictions, and we connect in through our Special Advisory Committee and the Council of Chief Medical Officers of Health. So as those things tend to get nearer, we'll need to have processes in place, because right now, our biggest risk is the importation of the virus. And, as we begin to loosen some of those travel restrictions, we'll need to have ways of following people new to the province.
And as a follow-up, Bart asks, how is Manitoba preparing for an influx of Manitobans returning from trips to North Dakota and Minnesota, and visitors from more infected Ontario and Quebec?
Yeah, well, I mean, right now this is obviously something that we've been working on, and right now we have the mandatory 14-day isolation period from all provinces, and that's how we've managed it right now. We've been at that increased risk of importation probably since the beginning of the epidemic. And then, of course, the travel restrictions and the measures under the Quarantine Act for the U.S. And so that may evolve over time. That's going to depend really not on our epidemiology, but the epidemiology around us. And so as that begins to evolve, we'll have to adapt to the way we're managing it. But that's our steps right now.
From the Canadian Press, Steve asks, we are seeing rising numbers in some U.S. states where restrictions on businesses and public gatherings have been limited. Is that a concern for you here in Manitoba?
So this is, as we start our reopening strategy, even from phase one, this is something that we're we're well aware of. In other jurisdictions, as they open up, you can see increased numbers, and it's something that we planned on. That's why we have our indicators that we follow daily for this. But that's why we've done it so gradually and wait those 2 incubation periods before we reopen further. And so it's something that we have to be aware of. We know that the restrictions that were in place can't be in place forever. We need to learn how to live with this virus. And Manitobans have to accept some level of risk as we move forward in order to open up the economy. And so it's just something that we're doing very slowly, very cautiously, and following those numbers very closely.
A follow-up question from Steve. Is there any new information available about the most recent cases in Winnipeg, that would be a trucker and a close household contact, and whether the trucking industry may require new measures.
So there's not really anything more to report on that. That the last two cases was a truck driver who traveled outside of Manitoba and their close contact. We've known for quite some time that the importation of virus is one of our biggest threats right now in Manitoba. But Manitobans know we have to accept some level of risk, right? We must keep our supply chains moving. And so we have to accept some risk for the transportation industry to keep functioning. But we have those cautions in. We have advice to those type of industries that need to leave the province and return to ensure they're very closely monitoring symptoms, to stay home as much as possible when they are back, to present for testing, to self-isolate immediately should any symptoms develop. And now for the trucking industry, we've offered the asymptomatic testing as well. So there are a lot of protective measures in place.
From CTV Winnipeg, John asks, can you comment on moving to twice weekly press conferences? Is this indicative of an improving situation for COVID-19 in Manitoba? Do you, Doctor, have any concerns that people will conclude they can lower their guard when it comes to precautions they should take?
Yeah, I think our message has always been clear, and the message that we get out there is that this is not a return to normal. That although we're reopening, you can see that there's a lot of restrictions still on businesses that are reopening. So I don't think Manitobans will think we're returning to normal. It's the actions of Manitobans that have put us in this position, actually. So Manitobans are well aware of the risk of this virus and the steps that they need to take. I think it's only natural as we see the less circulation of this virus, less detection of it, that we can decrease the amount of press conferences that we have, and it's just something that's really easy to ramp up should the need arise. So we're going to focus on this reopening, watch those numbers closely, and we'll keep Manitobans informed with the case numbers.
As a follow-up question, when it comes to ride sharing, is it safe to take rides from strangers, and what precautions should people take?
So I'll address that in relation to COVID-19. We're talking about safe from taking rides from strangers. I imagine that's on topic with COVID-19. So I think that, again, with the ensuring that lots of hand hygiene, people in those industries should again not be working should they have any symptoms, physical distancing when at all possible in those areas, make it reduce the risk to that. So it's just the typical precautions in those settings.
From Carol at the Free Press, with physical distancing restrictions loosening through much of Manitoba and the number of active cases so low, does the Winnipeg Remand Centre need to maintain its COVID-19 restrictions, keeping people locked up in small cells with just a bench and no toilet most of the time, as is the case?
So you can imagine that there's a number of public health interventions that were put in place, a lot of them focused on high-risk areas for outbreaks, and certainly that's one of them. And just like all of them, we continually revisit them, and it's always that balance, right? So there's the restrictions always place certain issues on individuals, but we know that we have to balance that with the risk should an outbreak occur in a correctional facility. So we'll look at that. We have our stakeholders that we can engage with, but just like any of our interventions, we're always reassessing the need for them.
And as a follow-up, a Winnipeg healthcare provider's COVID-19 screening questionnaire for patients who are booking appointments asks if they attended Friday's rally at the legislature, and if so, were they wearing masks and practicing physical distancing? Are those valid concerns and important questions for healthcare, and other service providers? And a follow-up for Dr. Roussin specifically, what were your thoughts looking at images of Friday's rally and the number of people not social distancing?
Yeah, so to ask that a questionnaire, probably minimal benefit to having that on a questionnaire and inquiring necessarily about the masks and things. I think that the questionnaire of what we have on there on our online screening tool is probably sufficient. In regards to rally, yeah, I mean, I think that where we are with COVID, we know that the large group settings do have carry some risk, for transmission. That's why we limit the group sizes. Certainly outdoors is a less risky situation. And then again, everything we do has that balance of the need for this demonstration balanced against some of the risks. So, from a public health perspective, our message was try to keep the group sizes to the recommended size. Wear non-medical masks if physical distancing wasn't available, but do try to physically distance.
Thank you. And again, to everyone participating today, we apologize for our technical difficulties. We'll certainly try to get things fixed up for the next media briefing. Thank you.
Thank you.